Good morning, Suprabhat. Very good morning. Yesterday we have learned about guna, guna of Manas Roga, Rajaguna and Tamaguna, right? Today we are going to learn or understand Trividha Parikshana. Trividha Parikshana. What we call Trividha Parikshana? Darshana Sparshana Prashnehi Pariksheta cha Roginam. Darshana Sparshana Prashnehi Pariksheta cha Loginam. That is Trividha Parikshanam. So when we understand about the Trividha Parikshana, what are we going to understand in Trividha Parikshana? Darshan, Sparshan and Prashnai. In clinical practice, in Ayurvedic clinical practice, these three parikshan is very, very important and have a very particular values. Variety of patients when we see in a clinical practice, first of all, darshan, how the patient is looking, how the structure of the patient, how he's walking, how is the gait, does he have any pain at knees, lumbar, neck, shoulder, how the stature of the patient is feeling, is he happy, is he in a pain, is he unable to walk, unable to sit. So the darshan of the patient explain the structure of the or the avastha of the rogaha. In clinical practice, many times I see only two avastha. One is the shaya avastha and one is the avarodha avastha. So many times in shaya avastha, the right side of the body getting affected a lot. And in avarodha avastha, kapha avastha, left side of the body get affected a lot. So how you going to explain? See, left side, right side. Okay. So here, if suppose a patient having a pain at the right knee, then a there will be a affected part like a yakruta. Look, yakrut and liver both are sharir kriyatmak, physiologically. Both are physiologically different in Ayurveda and modern science. But rachanatmak means anatomically both are same. Yakrut and liver. Anatomically both are the same. Anatomically both structure, their viscera, their ligaments, all are same. But physiologically, according to Ayurved is a Moolasthana of a Raktavasrotasa. And in modern, Yakruta or liver is the major lymphatic organ who does the all metabolic activity. Lipid metabolism, fat metabolism, protein metabolism, all metabolism is under control of the liver. but for the blood formation is occur in bone marrow, right? But what exactly we know that for the formation of a blood in bone marrow, iron, folic acid, calcium, B12, these are the vitamins is required, and these vitamins are absorbed from the intestine and stomach, metabolized in the liver, and through the hepatic transporter it goes to the bone marrow. So again, without liver, the iron, folic acid, B12, calcium cannot transport it to the bone marrow. So liver is very important in the formation of blood. So in different ways also, for blood formation liver is important. So whenever there is a anemic patient happen in anemia, what we see the pallorness, what we see the hepatitis B, hepatitis A, hepatitis B, hepatitis C, what happened? The pallorness, bilirubin level is increases, HGPT level, HOT level is increases, hemoglobin gain decreases. We see the sclera is pallor, skin getting pallor, abdomen getting yellowish, nail become pallor. This is darshana. We see the urine output getting decreases and a very yellowish, dark yellowish color urination is getting out. Urinary output getting decreases, volume of the blood getting decreases in this hepatitis or panduta of a patient where agni mandya is mostly occurred. So when we're talking about the panduta, kamala, in just by darshana of the patient, we get to know, we get the idea of the patient's diagnosis. In clinical practice, diagnosis is most important part, absolutely most important part. So why darshana is so important? If you talk about, let me, in how many ways you can, 1 minute. So in Trividha parikshana, darshana, darshan sparshan prakshnehi pariksheta cha roginam. So by darshan parikshana, in case of panduta, in case of kamala, we get to know about the diagnosis of the disease. Okay. Now in case of jwara also, the tapa, ushma getting out from the skin, and the ushnata is on the part of the skin. According to Ayurveda, there is ama, srotorodha, srotopidhana, right? And because of srotopidhana, swedava srotasavarodha, and ushma getting kundita, and daha, tapa is getting out of the body. that we call as a jwara. And to break down the samprapti of the jwara, we have to pachana of that ama, right? But what exactly happened in modern science? We just, by looking the thermometer, by checking the thermometer, we get to know that the patient having a fever of 99 or 100. But what exactly pathophysiology happened here? There might be a bacterial or viral infections. Because of that infection, the shota inflammation is occur. That inflammation stretch the arteries, the vessels near the skin or inside the body, and the thermal receptors which are the present in the artery wall get stimulated, and ushma and the heat is created. And in hypothalamus there is a thermal centers which trying to control the thermal centers, which try to control the thermal the temperature by stimulating the dilation process. So in this way, in different pathophysiology, different pathophysiologies occurs in modern and in Ayurveda. Yeah, we have completed Vipaka, Avastapaka. Okay. So in how many ways you can tell me darshan parikshana? In which are the disease? You can only by darshana you can diagnose. Darshana. Now if you talk about the tongue, if you talk about the tongue, if you're having a samata, white coated part, if you're having a samata, there will be a amavastha, samavastha. Okay. But on the tongue, there are different part where if the samavastha occur, we can understand on which part of the body getting affected, especially the tip of the tongue. If you make the tongue having a three quadrant, lower, middle, and upper part of the tongue, and again straight line 1 and 2, when we can got the lateral part of the tongue and medial part of the tongue and the central part of the tongue. Now how many quadrant had become? Around 1 2 3, 9 quadrant has been become, 9 quadrant on tongue. Okay. So the upper part of the tongue, upper middle part of the tongue is the part where it is a part of lungs. Upper lateral, upper medial is a part of lungs, right lungs and left lungs. Then the middle part, just below the middle part of the tongue, it is a part of a heart. Middle, it is a part of a heart. The medial lateral or middle right part of it is a part of a yakrut. Middle left is a part of a pliha. Lower middle part is a part of a intestine. Which intestine? Small intestine. Medial right part is again a part of a kidney, both kidneys, right and left. And just below the lower middle, there is a large intestine. So in this way, we can make a quadrant over the tongue, and on which part the samata has been occurs, we can diagnose in which part of the tongue is getting affected. The samata, if Most of the time, the pallorness, vitamin B12 deficiency, or panduta, or shaya avastha, the liver part, that is a right lateral part getting very much inflamed, reddish, inflamed, with ulceration, that is the shaya avastha at the liver. Most of the time, the middle of the tongue, just below the middle of the tongue part getting affected, getting samata, that is the grahani, agni, jataragni, getting affected. Most of the upper middle part, where the cracks on the on the lung, on the tongue, cracks on the tongue, straight cracks, that may be the affected part of the heart, rukshata, vayu rukshata. Most of the tongue, many time making very much dry, ruksha dry, kharata on tongues happen. There is a vata prakopa. Most of the time, tongue getting very whitish, complete whitish, yellowish coated. There is tivra samata. Sometimes the middle part having cracks many times. Then again the shaya avastha, yakruta avastha. In the absolutely middle, there will be affected part like a heart. Just below, just below the heart, there is a grahani. You have to see heart, grahani, and large intestine. Whenever there is a crack in the middle of the tongue, always go to see the ECG of that patient. Darshana, the various part of the darshana, we can understand the various diagnostic part. Acharya Charaka has given the very good diagnostic process for prameha. By just examination of urine, we got to know. Yeah, some black color of the tongue, there might be a genetical from the birth. It might be how from birth, that we can't. That might be a vata prakriti patient. From the birth, the black color of the tongue can happen. But the yellowish color, bluish color of the tongue, bluish color of the lips, that again, the hypoxic patient, when a baby get birth and the baby cannot cry, baby unable to get a breath properly, baby get hypoxic. And in that case, we got to know that the bluish discoloration of body, lips, tongue, it is a sign of the hypoxic case. It is also one of the darshana parikshana. When there is a cracks on the tongues, and when there is a dryness on the tongue, you can see the T wave inversion, a potassium level or the sodium level disturbance or electrolyte disturbance many time happens. Okay, so electrolyte disturbance, and because of that there is a deformity and contraction, a P wave and T wave, atrial contraction and ventricular relaxation. In these two process, P wave and T wave, we got the changes. Highly P wave and T wave inversion that will be happened. High sodium intake and low potassium intake, that creates the highly contraction and a low relaxation. In ECG, these are the changes we most of the time seen when there is having cracks on the tongue. So these are the darshan parikshana, by just the examination, by nadi parikshana, by netra parikshana, By netra parikshana, the pallorness, sclera, yellowish discoloration, spots on the eyes, dahata, reddish discoloration, inflammation, watery discharge, pus discharge. These are the many variant part. Like if there is a reddish discoloration on the sclera, there will be a pitta ruddhi, a krut dushti, high blood pressure. There is a protrusion of eyes. Protrusion of eyes. There may be a thyroid disorders, hormonal disorders. Sometimes you can understand by the eyelid getting drops, one eyelid getting drops. Then again a trigeminal nerves disorders, neuro, uh, neuropathic disorders. By of suddenly the eyelid getting, by just talking during the talk, the eyelid getting dropped for 1 to 2 minutes, and after 2 minutes it getting again upward. And sometimes they may having a severe pain on the shankha pradesha, on this eyelid area. This is a trigeminal neuralgia. Many times a tongue become a very bluish discoloration, bluish yellowish discoloration, having a continued ulceration in mouth, on tongue, a different type of mouth ulceration that may be a malignant or chronic mouth ulceration. Malignant, and whenever there is a malignant or the cancerous diagnosis, there should be a bluish yellowish discoloration, bluish whitish discoloration on the tongue. That may be a mouth cancer or the tongue cancer. It happen whenever there is a people having a eating of gutka, mawa, tobacco regularly, keeping in the mouth continuously. So whenever there is a cancerous or malignant disease, there always be a bluish, whitish discoloration. Even it is in a, nowadays the cervical cancer is increasing a lot. So for the all my, those are the patient like all of female patients who having a whitish discharge, continue whitish discharge, and they ignored continuously whitish discharge, and they ignored that whitish discharge. Sometimes it's a false smelly, sometimes it's just a watery. So in that case, one should understand, or a clinical practitioner should examine that part properly, and if he see there might be a reddish or the inflamed cervicitis or vaginitis. That is a normal part in happen in infectious part of the cervix or in vagina. But when you see the bluish whitish discoloration at the cervix, there is a cervical cancer. Nowadays there are many methods of like pap smear or colonoscopy, sorry, colposcopy. Method of colposcopy now is introduced, where we can understand by putting the dye. When we understand the examine by this examination, is there is a cervical cancer or not, and we, by early diagnosis, we can detect and treat that patient. It just, we need to see the darshana properly. Many times in a lung disease, lung disease, what we see, there is a pleural effusion. What we see in pleural effusion, that when patient getting a long breath, he having a pain at the left side of the body or the right side of the chest, and the corner, when we see the chest x-ray, right corner, left corner, you cannot see the left corner, a blunt corner, or there will be no corner, because at the corner there is a accumulation of the water or the liquid we see in the chest x-ray examination. The clumsy chest x-ray, clumsy chest x-ray, that might be a cuff here, or there will be a cotton like a blunt chest x-ray, like a cotton, a tubercular uh, chest infection. So by looking the x-rays, we can understand the different varieties of the chest infection, pleural effusion, or by tubercular infection, or by pneumonitic infection. Most of the time, we can see the the bronchi, swelled bronchi, that may be a bronchitis, alveolitis. We can see the trees of bronchi over there, over the lungs, with at the tip of the bronchi. We see the multiple clumsiness, that is bronchitis. That many times happens in COPD. A completely air cannot be goes inside the most part of the when we do the chest x-ray, we tell the patient to breathe a full breath, and then we do the x-ray. But in COPD patient unable to take a breath, full tidal volume is not getting properly, it getting inside the chest. So the lower border of the corner of the chest is not filled with the air. That again you will be seeing why it is not getting filled, because the alveoli getting inflamed, or might be there will be some watery accumulation that will be happened. Again, we can see by darshana of the x-ray, we understanding the cardiopathy or cardiomegaly by the darshana. If you're having that so much of instrument of examination in nowadays, we can understanding different part of the, again, thi- this is can be seen by, again, darshana part, ECG. In clinical practice, you should keep your ECG machine. If the patient having a palpitation, chest pain, left shoulder pain, left jaw pain, profuse sweating, a continued left shoulder pain from since 7 months, 7 day, last 7 days, continuous shoulder pain, is again there is a chances, or the shoulder or scapulary pain. Again, there is a chance of cardiopathy or the obstruction or during the coronary arteries. This again the darshana part. The patient when telling the symptoms, you need to be very calmly listen the symptoms of the patients, because patient want every detail. Patient want that the doctor should listen my every symptoms. Darshana part. I'm talking about the urinary part. In Prameha, Acharya Charaka has given the urinary examination for a Prameha. Just take the urine sample for 2 days in the test tube. Keep the urine sample for 2 days in test tube, or 48 hours or 24 hours, and keep that test tube under the sun or in the sunlights. After 24 hours, you will see the changes in the urinary sample. It become yellowish. It become cloudy. It become very much cloudy. Sometimes all the cloudiness get settled down, and transparent urine become a upper part. Sometimes it become greenish, sometimes it become brownish, sometimes it become orange. The different colors of urine get changes by the heat of the sun. And in the same method we do in a lab, we take the urine 5 ml of urinary sample, and by upper one third part we warm it by, and after warming that upper one third of the test tube, the urinary sample, if having the sugar, the sample changes the color. If it is a cloudiness, then there should be a under 200, there should be a sugar. If it is become a, it become a greenish, it become a 250. If it is become orange, brownish orange, it become a, it become a very much above the 300. So whatever the types of prameha given in a kafach prameha या कहा पायाचार्य charaka, like a sandra meha, shukla meha, so these all prameha varnana we can see by just keeping the urinary sample 24 hours in the test tube under the sunlight. The color changes, and according to the color we can understand which type of ramya it is. Manjista meha, haridra meha, again there is a pittaj meha, kala meha, madhu meha, again there is a vata meha. Yes, there is a madhu meha. The urine sample become a completely brownish like a madhu. Sugar 400, 500, highly sugar. Is again a darshana parikshana. Darshana parikshana. When you're looking the patient's structure, you will understand that every part, koshtuk shirsha, highly swelling knee. By looking the knee, you will understand there is accumulation of fluid, there is an inflammation of the ligaments, there is an inflammation of the intervertebral disc, there is a degenerative changes in the bones, there might be arthritis. In this type of the whatever we going to see in the digital x-ray, that you can understand by just looking the knee. In ayurvedic concept, yeah, we say that is a shotha, kapha avastha, vayu avastha, vata avastha, avarodha avastha. Whenever there is a crackling sound, crackling sound in the joints, in the neck, in the knee, there is again a decrease of snigdha avastha, snigdha guna, an increase of ruksha guna, khara guna. There is again an increase of vayu. There is again a shaya avastha. So whenever there is a degenerative changes, we're going to understand there is a shaya avastha. By just looking, by just hearing the, the sounds, varicose vein, by looking the varicose vein over the legs, you can understand that there is a varicosity, increased amount of a decreased amount of elasticity in the veins. Again, there is a rakta dhatu, mamsa dhatu, dushti, sudha kalpa, dushti. So in this way, the darshana parikshana, we're going to understand darshana. So much part. Again, nails, bluish discoloration of the nails, bluish discoloration. Again a syncope avastha or hypoxic patient, a cup-shaped nail, iron deficiency nail, brittle nails, iron, B12, calcium deficiency nail. Many times the nails become very blackish in iron deficiency. Many times there is a poisonous poison happen, poisoning of many, like snake poisoning or snake bite or this type of poison. The nail first became very affected. A bluish nail become in snake poison. In poisoning cases also, the nails as well as sclera pupil is getting first affected by people get constricted, continuously constricted in venotoxic, and in neurotoxic when people become completely dilated. So the various type of darshan parikshana we can understand, we can learn, we can understand sparshana and many more thing you can add. दर्शन के बारे में और कोई एग्जामिनेशन अगर आप चाहते हैं तो आप बोल सकते हैं. When the whole body is involved, why it exhibits in ekasthana? Like example, pathology. I didn't get your answer. Question. समझ में नहीं आया question. एकस्थाना. Anyone? Any questions regarding more darshan parikshana? By looking eyes, nose. Again, there's a nasal part, nasal part. Allergic rhinitis. No, it will be not be known. Single, if a single nail is there, then there will be a different part. If there is a single nail discoloration, there again a different part. It will be not iron deficiency or something. It will again a different part. It will be only a one nail getting infected or by समथिंग, मतलब अगर वो नेल किसी के मतलब नीचे आ गया हो या इट गेट compressed or it get hurt, then will be again a discoloration in that part. And if that person is will not remove that blood, if that blood is not getting removed, then the nail become very much bluish and blackish continuously, and after 1 or 2 months the nail get drops. So this type of infection happens. So I'm talking about the darshana. So in how many ways, other ways, which are the diseases are most commonly focus on darshan parikshana? We have already told that jwara is there. In rakta pitta avastha, udhva rakta pitta avastha, if the nasal bleeding is continuously glowing in this grishma rutu, you get to know that yeah, this is increased amount of pitta. But whenever there is a pure blood, when there is a pure blood is coming out of the nose, there might be a rakta pitta. But but sometimes a blood pressure is increases 220, 240. Then again there is a breaking of capillaries and arteries, and there will be a bleeding. And sometimes it goes continuously without increase of blood pressure also. It goes continuously. Then again there is a malignant part. We have to see nasal nasal smear. By checking the nasal smear, there might be a malignant part in nose. So there are various avastha of malignancy we need to focus whenever we focusing on any disease part. The acute and chronic, both avastha we need to focus. Sometimes the patient became very lethargic, no energy, increase of weight, Shuddha Manda, Agni Mandya. This happen sometimes. No more activity, very feeling lethargy and discharge, no energy. That might be one of the reason for the thyroid abnormality, mostly hypothyroidism. And sometimes there will be a tremors, palpitations, hair fall, crackling of knees, infertility, or dahata at sole, palm, burning sensation. That may be a hypothyroidism. So these are the symptoms. By looking the symptoms, by examining the symptom, we can understand is it a hypothyroidism or it is a hypothyroidism. So just by darshana parikshana, we can mostly diagnosed various diseases. Various diseases. If a patient telling you that I am having a pain in the stomach, I'm having a pain in the stomach by getting a food. After having a food, immediately I'm having the pain. And by darshana or by examination, that this again the prashna parikshana in prashna. Here, like by looking the hair, now there are lots of machine available in Amazon. Also, you can find out the machines of sclera examination, scalp examination. I'm sorry, scalp examination machines available by which we can understand the dryness of scalp. If the hair are become a splits, it become a very dry and kharata. Is again a vata dushti. So by giving the vata shamana medicine, this dryness and this rukshata of the hair become a decreases. Sometimes the splits hair is there, and the splits hair will also because of due to the rukshata of the hair is again the vayu vata dushti. Sometimes there will be a grayish hair, whitish hair, again a pitta ruddhi because of pitta ruddhi, increase amount of heat in the body, shaya avastha, there is a grayish hair, whitish hair, sometimes a large amount of hair fall. Again, there is a part wherein the vayu dushti and pitta dushti. Because of pitta dushti, increase amount of heat, the snigdata at the root of the hair is getting dried up and hair get fall. So we need to decrease the pitta, decrease the vata by pouring the snigdha gunatmak oil, by pouring the snigdha ahara in the body, we can decreases the khalitya and palitya. So these are the major thing we can understand by darshan parikshana. Okay. So tomorrow we will going to talk about the sparshan parikshana. What we understand by sparsha parikshana, what we understand by nadi parikshana, what we understand by abdominal examination, what we understand by chest examination, sparshan parikshana, what we understand by axillary examination, neck examination, sparshan parikshana, a detail of sparshan parikshana. And you also find out in your clinical practice in how many ways by sparshan parikshana you understand the disease diagnosis. Sparshan parikshana. sparsan, like if you pulling the pinna at downward and patient baby having a pain, there is an external auditory infection. And if you pulling the upper part of the pinna and the patient or baby having a pain, then there is a internal auditory canal or internal ear infection. So these are the tricks of the understanding by sparshana. In cases of pediatric cases, we going to understand this part very much. Okay, so today we have stopped. Tomorrow we will going to understand sparshana, parikshana, and you will also find out in how many ways